So namaste. I'm the executive director for One Heart Worldwide Nepal. By training, I'm a public health professional. I have been with this INGO from the beginning on and off. So One Heart Worldwide is a non-profit, registered in the US. Our head office is in the US, and we were registered, established as an INGO. We are working very closely with Ministry of Health, provincial government, local government, and other partners to strengthen the maternal and health services and well-beings of the mothers in rural Nepal, where we are working. So One Heart Worldwide model is to strengthen the government existing system, which I mentioned earlier. And a lot of development initiatives are done vertically or parallelly, and then when you have a donor funding, things works out quite well. But when you move out, leave the your project side, and things starts falling apart. So we have learned that this is not the best model to work, especially in the developmental agenda. So One Heart Worldwide starts working with the government. When you see our model called Network of Safety, and there you can see the government is our first thing. We start the conversation with them when we design the project. When we start anything, the conversation begins with their policies, procedures, and planning. Like now we have SDG goal, long-term plannings, now health security strategies going on. So we align with the government priorities and policy, and we also consult with the different technical divisions like Family Welfare Division, National Health Training Center, provincial government. So different government stakeholders. And based on that, we sit together and also see where the system is better and where we should extend our support. So the pandemic was something that taught a lot of new things, and it was bad and sad, but also there was a lot of opportunity for us to learn. Healthcare system was not, of course it was all over the world. Healthcare system stumbled to respond to the COVID. But I think even being in Nepal, I worked with so many different players in healthcare system. I think our healthcare system was resilient than we thought, but also there's a lot of areas to work on. Particularly, our local government was the last 5 years was a transition. They were learning, they're seeking a lot of ideas from different people and different system. So what we are seeing right now is, I think the local government has also realized it is important. The federal government has also realized that there is a lot of special preparedness and planning needs to be in place, which I have mentioned in the paper, how we can build a resilient health system so we can cope with this kind of pandemic or any kind of disaster that can come in the future. But I think these are all learnings that can be taken forward for the future when we work on the different policy procedure and preparedness.